as I was saying, hello, welcome everybody. Um, we're recording day 4 of our course today. Today's course is like super cool, and it's probably my favorite. If I have to choose one day in particular that I like day 4 because we talk about digital health. My idea is in the last class to do like micro topics, go over the different topics that we had in the middle, that we don't see more than chatting during the class, like maybe do a compilation of illnesses, pains, and injuries to boost your vocabulary. Um, in the second week, we talked about parts of the body, and maybe we can talk about medical cases, the hospital and medical staff, names of different parts of the hospital. We've been doing that, and during the last day, we're also going to do healthcare during the pandemic, which is kind of I think a topic that never runs out, that we always have the opportunity. So before I go, Maria, you were telling me you came to Spain recently. Um, was it to take any psychology exams? Maria, do I still have you there? I don't
Yes,
know.
sorry, I have someone now in the door, but sorry, I disconnected. Just 1 minute. Sorry,
Don't worry.
it's okay. Sorry, can you ask again? Could you
Yeah,
please ask
you,
again?
you you were taking some psychology exams maybe here or
No, I just went to visit my mother. My
oh
exams
okay.
are hopefully in at the end of January.
hmm And are you going to take the exams in? I think you were in Jeddah, no? Or no, you
In
were in
Riyadh.
Riyadh. You were in Riyadh. Is there an UNED center in Riyadh?
No, I have to travel. I have
You
to
have to
travel.
fly back. Are you going to
Yeah.
fly back, or are you going to just go take the opportunity and maybe have go on a trip and take it from a European UNED center? That would be cool. You could go to
No,
Rome.
I will fly to Spain and I will be maybe 2 weeks, three. Yeah.
Okay. What is your region of residence?
In Madrid.
Madrid.
I live in
Okay.
Madrid.
So
Yeah.
I think that with Madrid we have a lot of topics to talk about because healthcare has been in the news. I don't know if you've been aware of that. Um,
Yeah, with Ayuso.
yes, and
Torrejon Hospital.
yeah, they're big fans of her healthcare management and big
Yeah.
detractors. So uh, I'm going to try to push your keys and get your opinion on those topics. If you want to take it in that direction, if you prefer to make it politically neutral conversation, we can do that. I just want to talk about the facts, not to get into the politics of every person. And when you take your exams, are you going to? Do you have any other things? I'm going to write that word because it's a cool thing to. It's a cool
Yeah.
expression to know. Is there anything on your bucket list? Have you ever heard this expression?
Bucket list. Like things I want to do.
Exactly. Bucket list is like the thing that maybe for you it's for me it's very difficult to get good prices at Zara because I've always heard that
Yes,
Zara is like super
this
expensive
is the
internationally, and maybe if you walk into your local Zara, you get an
yeah,
immediate 30% discount.
yeah. This is the January sales, of course, of
Exactly,
course.
yeah.
That's why
So
I
that
travel.
shopping in Madrid is definitely on your bucket list, no?
Yeah, totally, totally. It's very cheap. The prices that we have in Madrid, in comparison with here, is super cheap, extremely cheap.
Is there anything that in comparison is cheap in Saudi Arabia?
Oof. Dates,
Okay, yeah, makes sense. You
dates.
have all the dates in the world, and
Yeah,
are you keen on dates?
yeah. I used to eat maybe per day 20 or more.
Okay. So you've substituted your typical pistachios or pipas
Yeah,
or peanuts for dates.
for
Pretty
dates.
fancy.
Yes.
And what I've heard is that in the Middle East, dates are absolutely delicious, and we really don't know what they taste like when we taste them here in Europe. Is that true?
Yeah, because in Madrid, I only know the dates from the Corte Inglés, Majut,
Yeah.
something like that. Very expensive and are full of sugar. But here are like another kind, well, thousand kind of dates. And there are dates without sugar, like
Okay.
naturally, no, it doesn't have sugar, are black.
Yes.
So,
Do you have to?
and
Do you have to? I don't know. Do you have to process them by, I don't know, toasting them like you do with cocoa or like with coffee? Is there anything that you have to? I'm gonna put dates up
no,
here in case people are saying, are they talking about
you just,
fritas? Yeah.
people here, they used to have a farm with palm trees. So you
Yes.
just pull from the branch, leave it dry, and it's ready.
And so it's the natural date just dried at room temperature is enough.
Yeah, in the
Okay.
kitchen.
And not even in Elche they have the habit of eating dates on a regular basis. I find that funny because in some parts of Spain the climate seems ideal for creating a date
Yeah,
habit.
Alicante.
But yeah, Alicante, for example, is excellent. But I would say also maybe even Malaga or Huelva that
Malaga,
have
yeah.
such phenomenal weather, and they have date palms. So I really don't know why they discard the fruit or they
I
sell it
don't
away.
know.
I really don't know what they do.
I,
You
I
know
think
that
that,
I had an acquaintance, and this is going to feel very funny. In Andalusia, there are olive trees, a lot of olive trees,
yeah.
but some cities have planted olive trees around the city as decoration. But there are also companies that exploit the olive trees that are in the typical roundabouts, and they produce hundreds of liters of oil. You would think you can't get very much out of those single olive trees that are here and there, but there are companies devoted to exploiting the isolated olive trees that are around cities.
Oh,
In Spain, it's all about olive trees and the olive oil and the pressed virgin olive oil, the
yeah.
first pressed. Yeah,
First cold press, yeah.
yes,
Very
exactly.
expensive.
Yes,
Yeah,
yes,
yeah.
yes. Interesting, interesting. Okay. Laila, what about yourself? You were talking to me about it being a rough patch. Have you ever heard that expression, a rough patch? I like to introduce these expressions that are like very colloquial, very useful. The bucket list, esas cosas que tienes que hacer antes de morir. In the case of what I was talking to Maria, it's more a to-do list more than a bucket list because a to-do list is what you do every time you come to Spain because it comes often. But a bucket list, for example, for me, is at least once in my life visiting Japan. For me, that's something that's really on my bucket list. If you tell me, are you ever going to parachute? Never. That's never going to be on my bucket list. I'm afraid of heights,
Para tirar
so
un
I would
paracaídas.
completely panic with that. Someone else is in the conversation, or Lida is having a conversation in the background, I think. Um, so tell me first, Lida, what's on your bucket list? Are there a couple of things that you want to do at least once in your life? Your microphone is closed. Feel free to open it whenever you want. I don't know if she's around or busy. Um, uh, Maria, I was telling her that well, she was telling me before you connected that she was going through a rough patch because at her clinic, she's a dental hygienist. If my memory serves me well, um, her workmate is what I understood has the flu, the influenza, and now this morning I was watching. I don't know if you saw the hour at which I posted in the group. I woke up very, very early this morning to get some work out of the way that I had pending, putting all the mess of the shared folder in order and getting it making it available for you guys. And But I was having breakfast at around, I don't know, 5:30, 6 o'clock in the morning. I turn on the news and I normally put on English or American news just to catch up what's happened overnight because they normally report about what's happened in the United States. And in ITV, they had their news segment or Sky News. I don't remember which one it was because I was flipping through the channels. They were talking about the super flu, and this has been epic in my high school. I work in a high school in the mornings, and in some classes there have been 50% absences at school. So it hit Spain around 15 days ago, and right now it's hitting the UK. I don't know if Laida is available. Maybe you can open your mic and tell us. Maria, is the super flu reaching Saudi Arabia, or are you safe for the
Yes,
moment?
yeah. We came back from Spain all sick with this horrible flu.
Yeah.
When I arrived here, almost all my family members were sick, but not sick 1, 2, 3 days, sick maybe for 3 weeks.
Yeah, it's crazy. It's like avian
Yeah,
flu plus COVID, plus the normal
everything.
flu, and some people were even catching a standard cold. So it was a there are four different
Mm.
variants that are killing a lot of people. I shouldn't have used that word because people literally die from this disease, but I was referring to non-lethally being in bed for weeks at an end. The avian flu is gripe A. It's
Mhm.
in Spain. It's being there are two populations that are being attacked by pandemics. Some are the chickens, and we also have the pork meat is endangered by pork diseases, pork related diseases that affect from what I heard, hundreds of thousands of pigs in farms mostly in Catalonia. COVID, um, as we expected, COVID has gone from being extremely lethal to becoming extremely annoying and a variant of the regular cold. The problem is that it overlaps. So I have friends that have been at home with a combination of the flu or the avian flu and COVID, and
Yeah.
that just leaves you defenseless. Um, Maria,
Yes.
in terms of did you test? I am a little bit lazy. I never take those pharmacy tests
The
to check what I
COVID.
have.
I
Yeah.
have some here at home, but no, I went to the doctor and I went to different doctors in Spain and here, and each doctor prescribed different things. Like some of them are antibiotic, the other nebulizer with these corticoids,
Hmm.
others just ibuprofen.
Hmm.
I don't know, a mix. But now we are all, thanks God, we are all healthy.
Yes.
And rest and rest.
There is this analgesic medicine that I have. For me, it's been a discovery. In English, they normally call it NAC. And I don't know if you've heard of this medicine. It's N-acetylcysteine. For me, this is the golden standard for whenever I catch the cold or something like that because it goes to my lungs and I feel the mucus there. And what this does is that it dissipates all the mucus in and I think it's in Spanish it's acetilcisteína. And it's a very strong anti-mucolytic agent, and for me this is always in my toolkit whenever I catch a cold. And the other one is one of those strong anti-flu medicines. I had a friend come over from the United States right around the time you were here, Maria, and he was telling me that the
Yes.
medicine here in Spain, anti-flu medicine, is so strong and so good that he was going to pack
Oh,
his
really?
suitcase full of anti-flu medicine, the Frenadol or the Gelocatil Forte, or
Fernandol, very famous,
yeah,
yeah. But I thought in US there are the strongest, no? There is one very famous that this something like deals or seals or I don't remember now.
Quills. I think it's called Quills.
Yeah, yeah. I
Yeah,
remember what. Yeah.
and I thought that too. But
Yes.
when he came here, he said,
Tylenol.
I've never had anything as effective as this. And you know that right now in the United States there's a very strong scare with the FDA, the Federal Drug Agency that is run
Mhm.
by um, a politician called Robert Kennedy, and he's very, very controversial because he doesn't have medical training and he gives very, very strong medical advice. So there's a lot of controversy. For example, he was pushing to eliminate one of the most important medicines in the United States called Tylenol, because there was an affection that he connected to Tylenol, but there is no scientific evidence. And this is the problem that we have nowadays. We're in a period where opinion seems to weigh as much as science, and that feels dangerous. Um, as a future health professional, Maria, how do you see our times? How do you see the times that we're living?
The times we are living now, regarding medication.
Regarding practicing, because right now it feels that there are two trends that are very harmful for physicians, well, for any kind of health professional. One is that mm, people copy and paste recommendations from the internet without sufficient knowledge, and that
Yes.
can apply to everything, to a toothache, a stomach ache, cancer, uh, a psychological problem, nervous breakdown. They'd rather ask Google and ask a professional. And the other
Yeah,
one
Google is
is
very dangerous.
is how militant um, uh, politics have become in going a little bit against science. And I think that that's one of the biggest dangers that I can perceive in the atmosphere. I don't know if you share that worry that I have, that I harbor.
Yeah, see, I share it, but I think people who is searching for a therapist or psychology has another point of view. I think common citizens don't search for a psychologist. I think someone that has little more knowledge, let's say more educated.
Mhm.
So I don't think it's in the same bag of people who is auto medicate themselves with pills, with tablets, following Google, following a president saying drink blanche,
Drink,
to
drink, drink bleach, right?
blanche to finish with the COVID or these things.
Exactly, yes.
So I think in my field will be different, but maybe for another's, yeah, it's an issue.
Yeah, I'm well, for example, one of the good one of the only positive effects that I've seen emerge from the period of COVID and the pandemic is the arrival of new generation vaccines. There's
Yes.
so much debate around vaccines, and the way that you pronounce this in English, vax, has produced a movement that is popularly called anti-vaxxers with a double X, which is probably the only time you're going to see that in English. Double X.
Mm.
An
Anti-vaxxer.
anti-vaxxer. Yes, it's a person that rejects
Okay.
vaccination, especially these new generation mRNA um, technology of vaccines. I was very fortunate because I was teaching English to the science department. It was post-COVID, but I would say post-COVID, the first wave. We were still mostly at home. Everything was online, and we were wearing masks. So during that period, um, and there was a very strong push to research new vaccines. A new kind of vaccine was developed. I don't know if you're aware that the vaccines that were developed in during the COVID period are a new generation of vaccines, and they work with a completely different kind of technology. They empty a virus and they fill it with um, genetic code that is supposed to uh, write an answer for the virus. This is in theory how it works, dumbed down and watered down from the point of view that I'm an English teacher and not a health expert. But basically, these new vaccines, they work in a completely different way as the vaccines that we've traditionally seen that maybe inject a portion of the virus to provoke your body to create antibodies and thus fight against the illness. The problem that COVID had is the same problem that the cold has, that the common cold has, that the virus that transfers these two diseases are very prone to mutation, and therefore it's very difficult to combat with a vaccine because they can overcome vaccination efforts in a very fast at a very fast pace. I don't know how did you live that period of COVID arriving and the vaccination effort that was around the world. I don't know if that was you were in Saudi Arabia, you were in Spain. Where were you exactly?
I was actually I was coming from China when
So
they
you were coming from
discovered COVID.
China, of
Yeah,
all places.
yeah, I was coming from China. I was in a plane and I saw a lot of people with the facial mask. And
Okay.
I worry, what is this? You know, that means they knew already. They knew.
Oh yeah. I
Yeah.
think that in 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 the Western world, um, we were we were just thinking that it was a Chinese thing, that it was going to be something that happened in China. But did you did you have any restrictions while you were there, or the restrictions weren't
No,
in
no,
place
no. I
yet?
was totally free. I was actually working there, and I was totally free. And I remember in the plane, I came as a passenger, and I saw a woman with the facial mask. This is curious. This was December of November or December, maybe
19,
2018,
19.
19, yeah.
Yeah.
So yeah,
I
yeah,
went
was
to I went to New York in during February, right before no or January 2020, and people were very worried in China, but they weren't worried in Europe and in the United States, as if that was never going to come to the Western world. And I think there was just an over relaxation from the rest of the world, and I think that's why China was able to subdue it very quickly because they had a lot of social preparation for what was necessary. And you were going from China to Spain or from China to somewhere else?
from China to Spain, and already I saw people with the mask. And later on, I don't know if you remember, there were some countries around January, February. There were some countries banned from traveling. No.
Yes.
So I was in Dubai, and I was in February in Dubai. They didn't let me. They didn't tell me why, but they didn't let me make check-in Dubai, Riyadh.
Hmm.
Something was going on, but because of my passport, Spanish passport.
Wow.
But they saw, yeah, because there were some countries banned for traveling before the COVID. So imagine
I
the
always
airlines knew
have the
already.
feeling that only in a couple of decades will we know all of the information.
Yes.
That there's so much that happened behind the curtains that we haven't seen. We haven't had more than a peek of what was really going on at the time.
Yes, yes, yes. I really want to know because the airlines already knew about this. And later on, I entered finally in Spain.
Hmm.
And now we suffered that lockdown.
Hmm.
Horrible.
Yeah. I'm going to stop talking about the pandemic because I don't know what I'm going to talk about in the next class because that was one of my key topics, and I have an entire presentation of things that I think are really cool to talk about today.
Yeah.
Digital health. How much do you embrace digital life in general? I mean, I've got a brother that has a smartwatch that tells him his not only his heart rates, the pace at which he runs, the heartbeats. It gives him other information, like the amount of oxygen that he has in blood, the amount of oxygen that he is able to produce during a day, which I did not know was even a thing, that you were able to produce oxygen for your blood, and that was a register that was very important to have if you want to stay fit and healthy. And other parameters. And he's obsessed with this data analytics of his own body. I don't think I'm there exactly, but I can tell you I'm completely innocent and out of this picture of checking once in a while how I'm doing in terms of my paces or my heart rates or whether my blood pressure is too low or too
I don't know.
high.
You should check. No, not like your brother, but you should check.
Yeah, I do, but I mean, I have one of these very basic smartwatches. So, what do you think? What do you think? What do you do? And what do you recommend your family and closer members of around you to do in terms of self-care?
It depends on the age. Depends of the
Okay.
age, the quality of life they are following. I don't know. Here in Saudi Arabia is very fashionable now. Everyone has these smartwatches. Um, they record their sleep, their steps, many things. There are private companies who can send you the menus, every meal to your house. Like, I don't know, maybe some people get paranoid little, no? But for me, the recommendation is just to be normal. If you don't feel anything weird, don't check anything. If you start feeling like you feel you have to be worried about something, just start checking, but don't get to like
Don't get
paranoid with
obsessed over it,
things. Yeah,
right?
don't get
Something like that.
obsessed because it's worse the obsession than the benefits. It's like when you want to lose weight and you start your diet. Sometimes your diet will make you to have bad mood,
Oh
to
yeah.
be yeah, to be well, like grumpy with everyone. They will destroy maybe your relations with people only for 5 kilos less. So it's better just to go with the flow, be normal. If you don't feel anything, just don't worry too much.
Okay. So, do you have a smartwatch?
Yes,
How much attention do you pay to your smartwatch?
I don't know.
I mean, for me, one of the key elements from that I've tried to tweak in my life, one of the things that I've tried to improve in my lifestyle to have healthier habits, mm, it's been on two fronts. I think I had a diet that was out of control. I think it was bad. It was pretty
Mm-hmm.
good, but it wasn't under control. I wasn't aware of what I was eating. And sometimes when you're not aware, you don't pay importance. I mean, you don't pay attention to maybe I've exceeded, maybe I've eaten a bit too much sweet this week, or maybe I haven't included enough protein. So
Mm-hmm.
keeping closer tabs es como mantenerlo de cerca, closer tabs on my diet, not go on an obsessive diet to reduce this or that. I try to eat a balanced diet. I try to cut on the carbs. Um, Eliminate processed foods. That's my new
This
mantra.
the key. Totally the key. Processed food kills you. Yeah.
Yeah, eliminate processed foods from my life as much as possible. And when I have processed food, to understand that that's an excess that is as dangerous or to do continuously as, or maybe even more than drinking alcohol or smoking. So I put processed food in that same category of it can
Mm-hmm.
be an addiction or it can be something that it's a bad habit. And the more you cut the bad habit, and if you eliminate it completely, the better. Fresh food, things that are not cooked, so I can cook them. Try to keep my diet balanced. The other thing is the secret killer. You were talking about processed foods will kill you. If something I think will kill you, for me, it's going to be sleep. This is one of
Yeah.
my biggest
I just record my
discoveries.
sleep with my smartwatch. I just record my sleep only. The only thing I
Okay.
record.
Okay. And this has been my pet project of this year, to sleep in a healthy manner. Today is one of my cheat days. I slept 6 hours maybe, which is not terrible, but not healthy. If it's sustained, maybe a bit less, 5.5, 5:45. I always try to keep it over 7 hours, and
Yes.
maybe my busy schedule impedes me sleeping more than 8 hours, except on weekends. But I try to put in as much sleep as possible during the summer. I try to let my body just go with the flow, and sleep as much as it needs, even if I get less things done during the day, because I can allow myself to be in a more relaxed manner. I don't know if you're worried in the same manner.
Yeah, I prioritize always my sleep. I take my naps every day.
Ooh, that's nice.
Yeah, every day naps 1 hour, 1 hour and a half. I need it. But I sleep at night maybe around 6, 7 hours or
Uh-huh.
less. Yeah.
Okay.
Yeah, but naps are mandatory. I just read the other day in the newspaper that Spanish people live longer because of the Mediterranean diet, the olive oil, and the naps.
And the
Siesta.
naps. Yeah,
Yeah.
yeah, yeah, yeah. And what do you think about um the digital disconnect? Are you able to achieve that? It feels
Yes.
it feels contradictory that we're invaded by more and more wearables. And at the same time, we're aware that we have to be less aware of digital life. It feels like contradictory.
It's an addiction. My mobile is disconnected every day from 5 to 8 to 8. From 5 to 8 p.m. I disconnect totally. There is a
5 to
mode.
8, you turn off your mobile phone. That is
Yeah,
very
there is
healthy.
a mode that I don't know when I choose it, but I cannot remove it now. So it's fantastic because from 5 to 8 p.m. there is a mindfulness, something like this.
Yeah.
I don't know. I don't remember. But any phone call will not enter, any WhatsApp, any email, nothing will enter.
Wow. And
Mindfulness. Yeah, I just remember now. Yeah.
the mindfulness option.
Yeah.
I'm
And
gonna
you
talk to my
choose the timing.
I'm gonna talk to my daughter about that. She
Yeah, it's
definitely needs a
amazing.
little bit of that. And yeah, I I I I normally have a 5 to 8 disconnect because I'm teaching at UNED somewhere. So yeah, I'm forced to be mindful in that
Mhm.
moment because I don't have my phone on me, or it's in my pocket, but I never take it out. So yeah, I would say that's something that's really interesting. My son, he started to study philosophy, and he's bought into the Stoic um perspective of life. uh,
Mhm.
he's taken all of the apps away from his home screen because he
Very
said
good.
they're a distraction, and he's changed the screen to black and white.
Very good. Yeah, that's
And I'm
another.
very proud of him because he's only 19, and you normally don't act this responsibly on your own. I have actually no pressure on him. It's his decision. He sometimes goes very mindful and says, "I'm going to the gym. I'm not going to need my phone. So I'm just going to go to the gym, or I'm going to go out with my friends. I don't need my phone. I
That's
have everybody there." And he just told me, "I'm going to be with this friend. If you ever need to contact me, just call him, because he'll just give me the phone." And that's really, really cool that to be able to separate yourself from the digital life.
with this age. Yeah,
Yeah, at
because
that age, yes, exactly.
it's,
Yeah, yeah,
it's
yeah.
really mature.
He's closed down most of his social media accounts. Uses Instagram a couple of hours a week. Incredible. I'm kind of I feel kind of guilty when I talk to him because he does a much better job at maintaining a digital balance
Mhm.
than I do. I'm a great geek of digital devices, and when I talk to doctors or health professionals, digital health is something that I find fascinating because I think that it opens so much possibilities. Um, you've had the opportunity, Maria, to see firsthand from the inside a health system, because if I'm not mistaken, your pregnancy and your delivery have been in Saudi Arabia, right?
Yes, yes, yes.
So you have a completely you have an insider view of what the Spanish system is like and what the Saudi system is like. Could you draw
Yeah,
some pros and cons of both of them?
yeah. Well, for example, in Spain, the public system, I don't know. I think you have to wait so much. The private is working well, but now what I see in Spain, everyone moves to private.
Mhm.
So you will
Yeah,
be
I mean,
waiting.
and here there's a lot of politics involved because, for example, this transference from public to private in Madrid, it is around 50%. I know this because I was working for Sanitas and I was working for Adeslas as an English teacher, so I'm
Mhm.
quite aware that they're very big in Madrid. But in the Basque Country, for example, it's like 7%. So
Oh.
this isn't about the private being better than the public or catering to different needs. Like, for example, when you have other public or private things like education or other aspects of life, it has to do a little bit with the macro political decisions taking place, the policies, the big numbers behind the policies. And in Madrid, there's definitely a step away from the public health system. So you were saying that the biggest problem that you see in public health is the
The
waiting
waiting
time.
list. Yeah.
Yes.
And even when you visit the clinic, there are maybe only 1, 2 doctors available, and
Mhm.
all the rooms empty.
Yes. And
I
what
don't
I
understand
yeah,
why.
I would say that management. I find that there's probably a gap in terms of ideal management. And I have a lot of doctor friends, both in the public and in the private system. And I really think that it's maybe not the best idea to have doctors become managers because probably they're fantastic doctors, but I don't
They
know.
don't have idea. Yeah.
I don't think their preparation leads them to be fantastic managers of hospital. I think that there always has to be a medical uh, director of a hospital that prioritizes the health, the health parts of what the business is. But there also has to be a person that is outside of the health world, just thinking about the big numbers and how to manage adequately the resources that are available. All places have limited resources. Even the public health system has limited resources. How do we best use those limited resources? I think that's something that the private sector had figured out better than the public sector. But as it has increased in usage, as this number has climbed, through the 30s, the 40%, the 50% of the population that now have a private insurance policy. I think that the private system has become very similar to the public system
Yeah,
in
totally,
Madrid.
totally. I remember
You
like 10 years ago in Madrid, if you want appointment, you have the appointment tomorrow. Now in the
dermatologist
private
tomorrow.
sector,
It's like, oh,
yeah,
do you want to wait for 20 minutes and the dermatologist will see you? And you were like, heck
yes,
yeah. And now it's like, oh yeah, they'll see you in March. And you're like, yeah, but it's December. Yeah,
yeah.
they'll see you in March.
But the thing is that we are paying taxes. But for example, me, I'm paying taxes here and I'm paying taxes in Spain. Very, very high amount of taxes in Spain because I'm working abroad.
Mhm.
And I feel insulted when I want to go to the public because it's closer to my house and there is no doctors. You have to come after 2 weeks. Normal appointment for a flu, you have to come after 2 weeks. This is
Yeah.
something crazy.
or
People die.
just walk into the emergency room and
Yeah.
actually misuse the emergency room because
Ah,
I mean you can wait there and say, yeah, I'm just sick today. In 2 weeks I'm not going to be sick. So
yeah.
yeah, it is kind of an emergency because it makes no sense for me to wait 2 weeks for flu medicine when I'm not going to have the flu anymore. But
Yeah.
that kind of mismanagement is what I'm talking about in the public health system. They have to figure that out better if they want the people to continue um, trusting the public system. And as you said, supports ideologically a system that is expensive to maintain by default because health is not supposed to be designed to make money. It's supposed to help people that need it. Um,
Be always available and always with normal waiting list. No.
Exactly, yes. Reasonable waiting times. And I think that in modern days we've come to a point where we're bordering the unreasonable waiting. What about in Saudi Arabia? What is it like?
Where Saudi Arabia, public health is normal. It's like the private in Spain. And private is super, super
Super
mega
fast.
luxury. You have many
Okay.
doctors. You use the applications. You can choose. You can put complaints after. You can. It's amazing. It's really, for example, if I want to visit the dermatologist tomorrow, maybe I have 20 to choose.
Wow.
You just study the profile. Okay, which one I like.
Okay. So
Study, even you have the information of their career, their
yeah.
experience.
So you go through a casting process of your doctor
Yes.
rather than I'm going to hire a doctor. I'm going to run a casting to see which one I like most.
Yeah. That's why we change so much. And you know what I observe here? Hospitals and clinics are like a social point.
Ah, okay. There's a lot of socialization there.
Yeah, like restaurants, coffee shops. Sometimes I have nothing to do, and I say, okay, what I'm missing now? Maybe I want to check. I don't know, podiatrist. I want to check something with my daughter. I want really because it's all included. It's very easy. It's near your house.
Yeah,
Yeah,
I
here
know
it's
you
really good.
in Spain there was a moment where banks felt a little bit that way. They were walking away from their traditional business and they started to open coffee shops inside the bank offices and it was like,
Yeah.
yeah, just come and hang out.
Yes.
I guess for Saudi Arabia now it's a medical clinics, no?
Yeah. Now you have even ballet parking. Really, you feel
Valet parking,
like queen.
that's cool.
Yeah, you have many things. Emergency depends of your insurance.
Mhm.
You have to be hospitalized. You have different kind of levels of rooms. You have even suites. Suites, 2 toilets, living room, something. And this is not something exceptional. This is for normal citizens with good insurance. Maybe an
Mhm.
engineer has this kind of insurance. So it's not
Mhm.
something that happens to a little percentage of populations. It's something really common here.
So luxury health and the inclusion of technology because there's a really cool video that I want to share with you guys this week, which is about a Chinese restaurant. Sorry, well, not a Chinese restaurant, Chinese hospital. And the way it worked. And it was I think it was Indian resident, or maybe she was American with Indian heritage, because she spoke. I, I remember it was flawless English, and she was in China, so she was recording like this sort of TikTok video of "Come with me to see what a day is like at a Chinese hospital," and she was a surgeon, so everything was super digital. She would touch on
Mhm.
screens. The scrubs would come through an automated machine. Everything was automated. There were robots moving the surgical elements from the operating room or the operating theater to hygiene point, so they could be sterilized again and then taken to the next stop. So there were a lot of inclusion of robots, which I have not seen in Spanish hospitals for the moment. There was a lot of automation behind the scenes, a lot of the back end has to do with computers, giant screens, touch screens, and machines that made the life of doctors uh, much more comfortable because one of the things that surgeons have to get sorted out in in a quick manner is getting their scrubs for operating, getting the special shoes that they have to wear in the operating room. All of that is automated, and the dropping point of all that super digital, super streamlined, which means like optimizado. I don't know if uh, your experience has to do a lot with um, a digital flavor of what we're used to, or it's just that it's very comfortable and it's very spacious and it's about the professionals that are there, or there's a lot of digital side to it that you don't see in Spain.
Yeah, actually, here, yeah, you're right. Also, here is like this boom, no, this digitalization.
like machines, devices. And also, what I observe here, there are a lot of workers in the hospitals, like many nurses, one for vital signs, one for checking other thing, one just to assist you when the doctor is making you the checkup, another
Mhm.
one typing in the computer. Many nurses, another is only the cleaner, another is only for the front desk, like a lot of workforce here.
So it feels like the healthcare boom um has not mitigated the amount of jobs available. It's expanded the amount of jobs available.
Yes, all
Mm,
for foreigners, because almost all doctors and nurses are all foreigners, all of them.
wow.
Yeah.
And are there any dressing restrictions for the nurses?
Any what, sorry? Pardon?
Dressing restrictions? Because I know that
No, they just
Saudi
have
Arabia
the.
has areas where they are more observant of religious customs, and maybe the dressing rules for women differ very much.
No. Now the country changed so much. No, they are wearing this nurse
The typical
pants,
nurse scrubs, no?
t-shirt. Yeah. They are very normal. All of them facial mask.
Mhm.
They are very smart, and just this normal pants and t-shirt. There's nothing.
So
No.
the normal scrubs that you would see in a European or in
Yeah,
an
in any
American
place, in
setting.
any country. Yeah.
Well, or in a Chinese, because the video that I saw from China, it resembled the same kind of wear that. So there I guess that is universalizing, and the economies that are flourishing in recent decades, like the stronger economies in the Middle East and the Asian economies are taking advantage of the possibility of including technology into the healthcare system. That
Totally.
do you think that Saudi Arabia is an attractive destination for health professionals?
Depends on the salary.
Well, I mean,
Uh,
I'm guessing that the salary is very,
yeah,
very
it's very high.
um very
I
high
don't have.
compared to Spain.
Yeah, it's very high. I ask because I don't bite my tongue. The other day I was asking the
How much do
nurses.
you make here?
I'm very, curious woman.
Well, this
No,
is
even
fantastic because that way you can spill the beans, which means contarnos el salseo, spill the beans.
yeah. A ver, yeah. For nurses, they told me there are different levels. Depends where
Mhm.
you are working. They are getting paid from 2,000 euros until 5,000.
Wow, that's a very healthy salary. That
Yes,
that
yes,
upper
yes.
range is like very, very nice. And would you say there's a 50-50 divide between men and women in the
There are more
nursing business?
women. Ah, you mean in the salaries?
No, in the workforce, uh, in
No, there are
nurses.
more women. More women, yeah.
Mhm.
I don't know
Okay.
why. Nurses more women.
I
Yeah,
mean, traditionally, it's been a traditionally
yes.
female job, and or it's been linked more to women than to men. There's a very famous American poet called Walt Whitman. He was one of the
Mhm.
first male nurses in combat, and and he was criticized terribly for being a nurse because they thought it wasn't a job for a man. I can't understand. It's like it's so physical. The job it can be so physical that I can't understand why there is this trend to attach it to any gender, either male or female. It's just I think it's something that has to be very vocational. And the
Yeah,
nurses that
yeah.
I know, both men and women, are very, very vocational, let alone the doctors, of course, with how difficult it is to become a doctor.
Yeah, I observe here nurses, they are from Asia. They are really extremely kind, They are from
Mhm.
Philippines, Indonesia. They are so nice. And you see between them, they have a good vibes between
Good
them.
atmosphere, no?
Yeah, very good.
So
And
it's a little bit like walking into a melting pot, no? To go into a Saudi hospital, no? You find uh, a myriad of nationalities.
yes, many nationalities. Here in this country,
In
in
general, no,
normal
I, I
days,
I
you
would I
find
would
many
guess that it's a
nationalities.
magnet for foreign talent from all around the world, but maybe in healthcare even more because it's flourishing so strongly.
Yeah, and now doctors, I visit many. I don't know. I don't know. I know my life here. Maybe I visit 10, 15 nationalities. The day I want to choose, you choose one. Yeah, let's go with this one. Let's see. Yeah, because the salaries are very high. Here, doctors maybe are getting paid more than 8,000 euros
Wow.
extra bonus with the surgeries they made. Uh, I don't know. For example, is they prescribe you some kind of test? I know they get commission.
Mm-hmm.
For example, you go with, I have a pain in my chest. Okay, let's check your plaques. Let's check your lungs. And
I
more,
got I
more.
got I got that feeling the other day when I was in a private doctor and I was saying, why is he so interested in my health? Because the doctor was very, very kind. He was super nice, but he was telling me he was attending me for something related to a procedure that I have to undergo, a surgery, minor surgery that I have to undergo during the summer, and he was
Mhm.
very, very interested in me visiting a completely unconnected specialist. And he was saying, I can set up the appointment for you and everything. And I was thinking, this is new. The doctor giving me an appointment for another specialist that I even haven't asked for that specialist. I was saying, yeah, sure, whatever you decide. If you think it's a good idea, it must be a good idea. I'm never going to go against the opinion of a medical professional. There you go. I'm gonna open that prescription that referral for you. That's how you call it, una derivación, a referral. Do you also get that feeling sometimes that they're referring you left and right?
And yeah, yeah. For example, my husband went the other day to I don't know which doctor was, ophthalmologist,
Yes.
and the same ophthalmologist, the same day when he finished with him, refers him to the cardiologist, and he gave him many, many, many checks. I told him this is not because they are worried about you, because they get commission on the blood test, the other test, the heartbeat. They are getting commission.
Yeah. This is incredible. Yeah, it's like, oh yeah, maybe there's something with with your blood pressure. So I'm gonna send you to the cardiologist right
Yes,
away.
like this was like this, and he spent
And
5 hours in the
and
hospital.
maybe 10, 15 years ago was, yeah, go check your heart rate to see if it's okay. And they would just tell you, this is something that you
Yeah,
should look into. And you're like, okay, it's up to me, apparently.
yeah,
So
but
I yeah, tell me.
as a patient, you don't know if it's true or not, if it's
I'm
something
going to listen
serious.
to them. If it's covered by my policy, I'm gonna go with
Yes.
it. That's my mantra. My mantra is, if I don't have to pay extra for it, if I don't have to pay a
Yes.
premium for it, I'm gonna take it. And if I have to take a premium, if I have to pay a premium, I'll at least consider it. I mean, it's not
Yeah.
off the table completely.
If it's included, okay. If I have to pay, no, I will think about. I will call
Yeah,
you
yeah.
back.
At least think about it because maybe that you're falling into a rabbit hole of visiting this doctor and that doctor and the next. So these are examples of these are prototypes. I mean, of course, there are a gazillion wearables, and I don't know how keen you are to adding wearables to your life. I f- uh, I used to work for Telefonica for their Internet of Things IoT department, and I had to write about technology. I wrote part of their website, and it was really cool because I had to investigate about things like this, like the typical wearables that they are designing for senior citizens. So it has an accelerometer, and if there is a difference of height that is very sudden, it triggers as if the senior citizen has fallen, so it sends an ambulance directly. I thought that kind of technology is really, really groundbreaking. People thinking about possibilities for technology, or private investigators and police force using wearable information to solve crimes, or there was another one related to health that is not that as obvious as a smartwatch or something like that. I don't know if you have anything in your radar related to health that well, there's these exoskeletons for people that have very, very limited mobility that can suddenly walk again, and in the future they're thinking about people that are strapped to a wheelchair to have exoskeletons that allow them to walk and carry more or less normal life. Is there anything in the wearable or technological area that you find especially interesting?
I think if it's helpful, it's okay, but it's little scary, no? Don't you think
It
it's little
is kind of scary. I mean, yeah,
yeah.
it is kind of scary
Like
because that,
superpowers?
and especially how much do you want to give up? And this is the ethical debate that is connected to this. How much of your privacy do you want to give away um in the pursuit of health? Because to be constantly monitored as if you were a prisoner and you were under house arrest feels like a little bit too much, don't you think?
Yeah, I think, all the information we give to these devices is spreading somewhere, for sure. And I think the most natural, the best. But where is the limit? Who say until
Exactly.
here? Yeah, where is the limit? What is the moral limit? Because for me, it's clear, but for another person,
And the other
has
one,
the limits.
who's benefiting from this? I mean, if for example, one of the ethical debates and one of the things that I wrote about in these posts was maybe you go for a heart check um, because you've been noticing some pain in your chest, and and they recommend you to wear a smartwatch for a few days, a special, very accurate smartwatch, and and because of the ties of the company that owns the smartwatch or the health company,
Mm-hmm.
the health service provider, 6 months later when you go to sign the mortgage of your new house
Mm-hmm.
and you want to sign a 15-year mortgage, your bank says, yeah,
Yes.
we've made a risk assessment and this company has sold us your information. So we're going to say 10 years. We don't want to give you a 15-year mortgage. And you're like, oh my God, this is really going to change my life.
Yeah, we have been observed for sure. I'm totally clear about this idea. Each one we have a smartwatch, any wireless device, we are being observed. Not with someone monitoring 24/7, no, but what you say, they will use the information for something, for statistics, for something.
Yes. Yeah. I'm just writing down these ideas so I can share some of the things that I normally monitor on the internet. There was one of the biggest hacks in the history of technology came through a mistake. There was a video game. I don't know if you've ever heard of it, Angry Birds. Uh, Angry Birds was one of the most downloaded games in the world.
Mm-hmm.
So at a certain point, like 40% of the people had Angry Birds on their phones. Some of the phones even came with Angry Birds. Well, Angry Birds, when they were designing it, they were checking the features of the telephone, and
Mm-hmm.
they found a way to ping the GPS with Angry Birds. So
Okay.
a lot of companies bought hacked information from Angry Birds to discover the social behavior of the people that had Angry Birds with which was a share of everybody. So they knew how many people moved through certain parts of the city, how many people had certain habits that were healthy or unhealthy, and they could make decisions based on that. So this is what the dangerous or the scary part of wearables, the scary part of connecting technology to health, that it can be used
Yes,
against you.
totally. I totally agree with that point. Even the TV, when the TV is off, the camera of the TV is recording in your house.
Yeah, or well, I mean, I've got I can't name the device that I have. I have an Amazon owned device in my living room, and this it's very similar to the name Alex. But if I say any word that is similar to that, maybe even that one, it starts
Yes.
to record in the background. It's always recording, and it
Yeah.
just deletes the recording information once in a while. Or that's what Amazon says. I don't know if it's true
That's
because
what they say.
And in the same way they're recording and erasing, maybe they're recording private conversations or when you're
Yeah.
in and when you're out of your house or things like that that are scary.
For example, I will ask you something because you told me you're recording the data of your sleep, right?
Yes.
Don't you have an option that is say record your breathing?
Oh, yes, I do. But yeah, I don't feel very comfortable with that.
No, I cancel this because actually it's recording your sound, your conversation,
Yes,
your
yes, yes,
voice, you
yes.
know, not
It
only you,
feels
the whole room.
it's past the threshold of creepiness. It's very, very, very
Yeah.
creepy.
So this I say each time I have the question recording your breathing, I say no, this is a spy.
I think you're going to appreciate the next part of the conversation, and I'm so happy that you connected today because um even though it's only you, and I think we're having a great conversation about this, you're gonna love this one because I've been thinking that this is like mm, the holy grail of digital health, but at the same time, an enormous Pandora box. The Holy
Yes.
Grail means that it's like the solution of all the things that that we complain about regarding our health, and at the same time, it's super dangerous because we've already seen a million times how ideas that were designed for the improvement of humanity were used for all the wrong reasons except for the good ones. And this word that it's a third word here, the EHRS, which is the health record, la historia clínica, historia médica.
Okay. Health
But
record.
this one is called the electronic health record. It can also be called the medical record. So you can see EHRS or EHMS. An HRS or an HMS is a traditional. I remember when I was a kid and I came from United States to Spain, my mom would take me to the doctor, and they had like this enormous room that had like file cabinets that they had to move with a special wheel, and they
Yes.
selected my record from one of those cabinets and they would take it to the doctor's office. The doctor would look through the papers and write down that information. Nowadays,
Yeah.
when I go to the social security, to the public health system, like you have very recently, they type it up in a computer. But
Yes.
then maybe you say, okay, I need to see a dermatologist while I'm here in Spain, but the public health system is very slow. They're going to give me an appointment for February. I'm not going to be in Spain in February. So I'm just going to go to Giron. So you go to Giron and they
Yeah.
write down the information. And the following time you come, you say, okay, Giron's all full. I'm going to go to HMS or Sanitas. And then you go to another health provider, and then you go back to Saudi Arabia and you see another health specialist. And
Yes.
your health information is disseminated all around these different islands, and in no moment is it together. And that feels like a very bad way of
And
keeping
personal.
a full record and helping the doctor figure out what's wrong with you because they don't have the information.
Yeah, and you have to tell the history all the time
You
again.
either go with a ton of reports every time you visit a doctor, or you're not in a good place. You're not giving them all the information they need. So how do you
Yeah,
feel about this dissemination of your medical information?
uh, I don't know. We cannot do anything. For me, I try to do everything here, but sometimes when I need Spain, I need to go. But each time I go to Spain and I go to the doctor, I have to tell all my history. Like, yes, I had asthma when I was 8. I have this. I have okay, and they are typing and they don't look to your face and
Oh, that's one of the things I was going to talk about. The how the interaction with the patient has changed. Yes,
yeah.
completely. You're a future health professional, and I've talked to a lot of gynecologists because that was the area that I had students from in Sanitas,
Mm-hmm.
gynecology, and they told me that it's weird that they spend 90% of their time in an office
Mm-hmm.
talking to patients, and that's the only thing they never study at university. Nobody teaches you how to deal with people,
Yeah.
and it's probably the most important part of their job. And this
Yeah.
is what I find fascinating about the way that, but I mean, I'm a teacher, and at university we learn about our skill, then we take a master's to become a teacher, and we learn about families, we learn about problematic students, we learn about, I don't know, ADHD, we learn about a million things, but nobody tells us how to manage a class and how to deal with angry parents, or how to deal with a student that is conflicted, and that's going to be 90% of your job. So I think that in these in many professions, the bread and butter, el día a día, is a thing that is that they pay less attention to. I don't know if you agree with me on that.
Yeah, they totally. We're all in Spain. Here, no, here they pamper you so much. I think they train them to pamper the patient.
Mhm.
But like, like it's a must, like a part of a procedure, to look to your eyes, to talk to you, to say something funny. I don't know. I think maybe the culture here, is so kind.
Or maybe they've adapted the study plans in Saudi Arabia, and they still have it in Spain.
Yeah, maybe, I don't know, but in Spain it's so cold. It's not cold. The war is fast. They are waiting.
Haven't you ever been at a doctor that you just hate the experience because they never get to look at you? I mean, I in my new doctor, I have a new family doctor. My previous family doctor transferred to another place, and it's a kind of a catastrophe for me, because I really trusted her, and we had like very good rapport, very good this the trust building over 2 decades, going to the same doctor. All of a sudden, you go to the doctor and it's a new person, and you ask
Yeah.
about your old doctor, and they just tell you she's not here anymore. Of course, by privacy laws, they're not allowed to give you more information. So you really don't know what's happened to your previous doctor. I think she's been transferred. I really don't know for sure. And this new doctor, she never looks at you when you walk into the through the door. She says sit down, and she's already typing into her computer.
Yes.
She
That's
asks you, "Can you tell me what's the matter?" And she's wearing a mask, so you don't even see her mouth. I don't know what her mouth's like. And and I don't know if you have that feeling, but when I was when I was going through the pandemic, one of the most shocking things was people that I had never met without a mask, meeting them after the pandemic, because the lower
Yeah.
part of their face was completely different to what I had imagined in my head. This happened to me so many times, and this doctor uh, never works without the mask. So I only see her mask face. I never get to see her eyes because she's looking at the computer. She just glances at me once in a while, and she's typing it up. And I guess for her, it's very important to keep the record of everything she wants to do. But I have no real human conversation with her. That's the feeling that I get.
Yeah, that they don't listen you. That it's not something like connect with you.
It's a transaction. It feels like going to the bank.
Totally. Even sometimes they don't want even to check. For example, here in Saudi, each time you visit the doctor for anything, you pass from vital signs, temperature, this. Later on, if you go with kids, they put the kids in the stretch, they check this, that, move, do this, and they start talking about many things. Even they ask about your delivery, pre-term, post-term, you breastfeed, you didn't breastfeed, many questions. But when I'm in Spain, they just, I don't know, my girl is very skinny, he's coughing, she's this. Okay, I look at her, she's healthy, she's happy, nothing happened. No, please check everything.
Yeah.
Even I have to say, please check the ears. You haven't checked the ears. No, it's okay. Please, can you do it?
If she's
Yeah.
smiling, there's no ear pain. It's like move on, please.
Yeah. They answered me once. It was crazy, really.
Yeah. So you think it might be training, no? I from what you say, it must be training.
Totally. And I don't know. I think the issue in Spain that it's not easy to uh, put an official complaint. It's not
Mhm.
easy.
And I'm not sure if it's the health professional or the system that's broken.
I think there's a system that stress the health professional.
Yeah.
and she has miss.
There has to be, I think there has to be a sort of refoundation of what the basics are in this new healthcare with technology. They have to go back to the drawing board and figure out. How comfortable would you feel if your medical record was part of your, let's say, your DNA, your identification card, and you carried all of your health information with you?
No, I will not allow this. I will
You would
lose
not allow
my
this.
citizenship. No, I will lose my citizenship from any country. I will cancel my Spanish passport if this happen. I will not pay my taxes. No.
It's the most hackable information and the most useful hack in the world. So it's at the same time, this situation, which seems terrible, is actually a great solution because it's impossible to completely hack all of your medical information because it's dispersed in so many different islands that they can have part of your information.
But
I
who
review-
will benefit this? To whom? I don't see a point that this information will benefit to anyone, and I don't know.
This is the next the next point I'm going to talk about, AI. I have a relative that has gone through a very serious medical condition,
Mhm.
and this person has been very pragmatic. And what they've done is they said, okay, I have to go through the situation. It's a life-threatening situation. Fortunately, I have private insurance, so I can follow through this disease both in the public system and in the private. And what this person did was constantly interact with AI as a third doctor to check what they should be asking both the private and the public health professionals. Like, what can the public service provide that the private service is not going to want to provide because it's expensive? For example, your treatment. Okay, and what is a private service going to provide that my public service will not give me? Well, for example, your medicine, because you can charge it against your private policy. So this kind of back and forth of having like an AI coach, not a doctor, but a coach that tells you how to use your health assets, is something that people don't know or wouldn't think of, and is an interesting new option that we have that maybe 3 years ago we didn't have. So how do you see this reality?
I don't know. I think now it's happening now. It really is happening because even when you go to Google, you have the option, no AI there. But I think we cannot stop it. It's not something positive. I think we'll make a patient to get little paranoid or bossy, with their doctors, like or with the
I mean,
insurance.
I'm a teacher and I'm absolutely bilingual, but I have parents that I'm absolutely positive have an intermediate or a lower level of English that challenge my English grades to their children, and this is just part of the job. You have to live with this new reality where everybody feels that they have a lot of information that keeps them in control, but sometimes they just have bits and pieces of information, but they're not experts, and they can never be experts.
Yeah, of course, they can never be experts. And also, what I think helps if the government is supporting the real professionals.
Yes, empowering the empowerment is
and there are laws. There are laws that you cannot do this, you cannot pass this line. I don't know. I think that the law in Spain is very lax, very loose. So you can do anything you want. You can be confrontations with professionals even without any proof. So yeah.
I agree completely. Like, I'm in the educational system, but I think that we suffer the same kind of pressure of sometimes feeling that not only the authority is questioned, but that the authority is challenged, sometimes even physically. There is a sense of danger that I can see that Alexis is here. Alexis, how are you? Alexis, can you hear us? I can hear some sound in the background, but I don't know if you, if you're able to talk. Okay, I'll continue with Maria. Alexis, if you manage to fix your mic, just chip in. We're talking about technology and healthcare. Right now, we were talking about the authority component, how it has become sometimes dangerous for the health professional to give certain kinds of advice because what Maria was saying, there's constant questioning. As a future health professional, or yeah, health professional for sure, Maria, uh, are you excited about the possibility of being a professional therapist? Are
Yes, of
you
course.
are you I don't know, worried about this sense of empowerment that patients sometimes have to question the knowledge and use Dr. Google. This is how they called it. And my students would call my doctor students would call him Dr. Google. They ask Dr. Google and they think they know everything. So they go in,
Yeah.
for example, what happened to my gyneco. I mean, this is a very funny situation. I taught a lot of gynecologists, and of course, to prepare my classes, I had to read a lot about gynecology. So I'm probably the person that is not creepy, that knows the most about gynecology, that has not studied any medicine at all, and he's a man. So when I was talking to my my doctor students, they were telling me that patients would walk in with a list of the things that they thought happened to them because they had looked them up on Google. So don't you think this is something that is very probable that you will encounter when you become a therapist?
Yeah, of course. Overall, mentally illness is not something that has, let's say, borders, limits. Everything is possible. It's not like I have a stomach ache. It's
Mhm.
something that goes farther. Yeah, of course, I think it will be challenging. But, for example, we have the right, if we don't want to attend someone because it's passing the limit, we will not attend the person.
Mhm.
I'm not
No.
worried about this. I have I have my borders, my boundaries.
Uh-huh. But I mean, it is very annoying. As a teacher, I can tell you it's very annoying. I have to correct works of literature every year. Well, I mean, I think it happens to me in many instances. I teach, for example, I'm a C2 teacher. I'm the coordinator of the C2 level in English in Adunet. And C2 is a very demanding level. I mean, if you try to take a C2 course,
Mhm.
you have to have very, very good English. Maria, you could look into that. That would be a nice title for you to add to your belt. Your English is very good. I think you could go for that.
Oh,
Um, and,
thank you.
and you would get a discount for being an UNED student because you've already signed up to this course. So you would get a
Very
discount
good.
next course if you attempt that. So uh, when the exams come and the examination period is over, they have the opportunity to request a review,
Mhm.
and you see that the people that request a review are requesting it not out of knowledge um, that they know that they did a good job and you didn't give them the correct mark or the correct grade.
Mhm.
It's based on the fact that they think they have the right to complain. And
Wow.
I think this happens a lot to patients. It happens a lot to students. It happens a lot to everybody that feel that they're paying for a service, and they actually feel that there's a certain sense of entitlement of the user side. I don't know if you understand what I mean, and if you agree with what I say. If you don't agree, that's great because a little
You
bit of
mean because they
disagreement.
got the service, they have the right to complain, or they have the
Exactly.
right
Yes.
to
Either
put a
whether they're
review?
right or wrong. For example, I teach American literature. I've been teaching the same subject for 12 years. I think I'm a bit
Yes,
of an expert in the subject.
for sure.
And I get questioned about why I gave them a 6 and not a 6.5. And they think they deserve a 9 instead of a 6. And I say, no, you're missing this, this, and this. And then they answer back and they say, no, 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 I'm sure I got this. And what you see is that the people that complain are not
Yes.
the people that are better prepared. They're the people that maybe have checked with ChatGPT or have Googled an answer, not the people that
Maybe because
actually do the hard work and study.
yeah, I think maybe because they want to increase the score. You know, this
Exactly.
happens so much in the unit exams. I
Yes.
observe that we have groups in Telegram, no, in Instagram.
Oh
Telegram.
yes, yes. Those
We
are
have groups.
those are like parent
Yeah,
chats in
and those
for
who
schools.
those who didn't reach the 5
Yes,
are those who are encouraging all the group to complain about some questions. No,
exactly.
sorry,
Yeah.
study more.
Don't you think this question should be tossed out? And it's like, yeah, man, you got a 3. I mean, I got a 7, and I'm not
Yes,
complaining.
yes,
Yeah,
yeah. I don't know.
totally.
Their complaint says more about them than about the teacher or the exams or whatever. They didn't make the effort they should.
Mhm. Yeah, yeah, completely. I agree completely. Thanks a lot for helping me with Alexis. I was trying to um, get some information about the mic. I guess there's a microphone
Uh,
problem. Alexis, maybe if you try from a smartphone, even if you open a second connection, you could probably connect your voice to the smartphone microphone. The link that I sent you works everywhere. So if you try it on your phone, if you have battery, it's gonna work. I'm in a mindfulness moment. I set my mobile phone to another room, so I can't check it now. I'm following Maria Luengo's advice. She's going to be my wellness guru from now on. I totally dig your vibe about this, Maria. I like that idea of the 5-2-8 pause, uh, just to be present, which is what I demand my kids to be present. Um,
yes,
the other thing that I
awesome.
was talking about AI, Maria, and maybe
Mhm.
in this you agree with me. Maybe if you're going through a period, for example, you get, for example, women uh, get tested for breast cancer every 2 years, if I'm not mistaken. Men get frequently tested after they turn 45 or 50 for colon cancer. Um,
Mhm.
Something that we could do is probably speed up the testing process, including AI or some kind of artificial intelligence to detect what patients need retesting, maybe on the same day, maybe within the same hour. How do you feel about sharing that information, maybe with technology service providers? Is that dangerous or is it worth the risk? How do you see that?
I don't know. I think sometimes you don't want even the patient doesn't want even to know this information. So should not be shared spread with anyone because I have friends that they are sick and they don't want to go to the doctor. They say whatever happened, I don't want to check. So if even they don't want to have this information, what the information should be shared with any provider, any company, I don't think is right. No.
Uh, I have very mixed feelings. I have to disagree with you on that one because
Okay.
um, early diagnose can be the difference between a healthy recovery or fatal
If the
consequences.
patient wants to know,
Okay, yeah, you're right. You're right.
yeah, because it's
But do
the
you think
right
that
of the
patients
patient.
that don't want to know is maybe out of fear of the consequences of oversharing?
Yeah, of course. I
I
know many
mean,
people who doesn't want to know anything more than what they know.
okay.
Yeah, it's until here. I don't even people, for example, the father of a friend has to pass through a surgery, prostata surgery, something like
Mhm.
that. But he didn't pass.
Prostate surgery, yes.
Yeah, but he didn't attend it because he said, I don't have pain. I don't feel anything. Why? Because the doctor says. And he said, I don't want to know. I don't have any pain. I don't have any sickness. I don't want to know. And I totally respect that decision. Don't
That's,
share any information. Don't tell me. If I don't complain, don't.
oh gosh, that is a that is a very strong barrier. And for example, in Saudi Arabia, I'm sure they're oversharing because it is so advanced that there is a tendency. If you have the information, use it, of course.
Yeah, there is a lot of
Oversharing.
Oversharing and
Yeah.
in the artificial intelligence devices. This is for me is overwhelming me really. Oof, too
And
much.
and how would you feel? You gave a very interesting you gave a very interesting insight about the experience of visiting a doctor in a country that has advanced so much in health like Saudi Arabia. You mentioned that it had a very strong social component, and I completely agree with you. So how do you
Yes,
feel
yes.
about maybe when you have a medical appointment to get it through a video conference, or maybe even through WhatsApp, and send pictures to your doctor of your
Oof,
maybe, for example, your dermatologist. In Spain, it's becoming super normal to send a picture to a dermatologist
oof.
as the first point of entry for a consultation.
I don't know. Depends of how it's working for the person. Maybe the person is so busy, extremely busy, and cannot visit the doctor.
or
I
or
don't know.
or, or to beat that idea of the wait. Maybe if the doctor is spending 10 minutes with every patient because of the back and forth of normal conversation, but with a teleconsultation, or even if it is sent to the doctor, eh, the doctor can cover 7 or 8 patients in the same span that he would normally, or they would normally cover one.
Yeah, but the quality is not the same. You know, the attention, the need to be seen as a person. Just the only reason to get ready, to dress you up, to go out, I think can change so much your health status. You know, someone who has depression,
I agree, but
in
at the same time, I think that I never feel more vulnerable than when I'm in a hospital. I've only
yeah,
been in a
but
hospital
sometimes
two or
you
three
need to
times
know.
for like big things, like having to wear. For me, the terrible moment is when I have to wear like a hospital garment, those
Mm,
that seem to want to humiliate you on the back because they're
yes.
completely open, and I never feel more vulnerable than that, because
Yeah,
you
this
can't even
horrible.
wear your socks, and
Yeah.
the floors are cold, so you feel like
And
you're
if the
in you're
person
in your
is rude,
most vulnerable moments. It's like,
yeah,
I
if the
hope there isn't a
person is
fire
rude,
alarm, because I'm gonna have to go literally butt naked with no shoes or socks to the
yeah,
street.
yeah. Yeah, this horrible. Yeah, yeah. Yeah, that's horrible. Yeah, but I don't know. I think sometimes, for example, you need to make a phone call to the doctor that which helps you, but sometimes you need to visit. Of course, this moment with the bath, with all the back open, is totally vulnerable. But sometimes you need it. Sometimes you need to visit. Sometimes no. I think it's really important. Don't isolate the citizens. Don't isolate people with the screens, with phone
Mhm.
calls, and personal conversations are doing so much. For example, here in psychology, it's not working the same a therapy online that a therapy in person. It's not working the same.
But there's been a boom in online therapy.
Yes, there
Probably
is
the
a boom
biggest,
because people are so busy.
and maybe because they have the perception that it's cheaper, no?
I don't know. Cheaper, I don't know. I think has the same price.
Okay. And
If the
and do you
doctor
think
is
it should
good,
have the
it's
same price? As a
yeah.
professional, what do you think? I mean, if you pay for a practice, and you have your decoration and your cleaning lady, and you pay your electricity bills, and someone does it from their living room, shouldn't they
Yeah.
be charging less for that?
No, it's because it's taking your
Hmm.
time. Taking
Yeah,
your
I
time.
mean, from the professional point of view, shouldn't um, a teleconsultation be cheaper than physical consultation for the patient? And therefore, because
Actually, now you're
the
right.
doctor
Yeah.
is adding, or well, sorry, the doctor, the professional, the healthcare professional, the therapist is adding a markup that you need to cover the regular expenses like rent,
Rent
or
bills, yes.
bills,
Workers,
yeah.
the
So
secretary,
you
yeah.
you need that markup. Maybe if I don't know how much an hour of a psychologist can cost, maybe 60, 90, 100
Yeah,
euros.
more or
Um,
less.
if I guess that 10, 15, 20% of that is a markup designed keep the practice open. So if
Yes.
you're doing this from your living room, should you be charging $100 instead of 80? Maybe you should be charging 80.
Maybe yeah, you're right. I never thought about this, but who knows you are in the living room if the person is maybe in another country. Maybe you are, in your clinic, or maybe
In
you
your
are in your
practice, yeah.
yeah, they don't know. But no, yes, you are right. I never thought about this. Maybe should be cheaper when you are
It,
online.
it should
Yes.
at least slightly cheaper, no? I mean, it does feel that you're getting less of the. I mean, you can't recline on those comfortable sofas
You
that they
can
seem
have
to
the
have.
pajama
You know?
down,
Yeah.
pants,
You don't have that
slippers.
divan experience. Yeah, you need the recliner. You need the recliner experience or Pilates. I think it makes sense. Maria, get in the situation of you decide to have a second child. You only have one daughter, no?
I have two. I have two.
You have two. Okay, so you go for the triplet. I've always thought that two is a perfect number because that's the amount of arms that we have, and when both parents are not around, that's as much as I feel I can handle. So I have two kids, and I always recommend two kids is okay. Three is like you're my personal hero. Imagine that you decide to go for a third one, and when you go to your super high tech Gynob, in Gynob in American Health. I don't know if in England. I have to check that.
Obligation.
Obstetricians and gynecologists share the same university career, so they're normally called Gynobs.
Yeah.
A gynecologist or obstetrician. So you go to your gynob and they give you exciting news. They say there's this new belt that is elastic, super comfortable, that sends us information about your fetus, about the baby, and about your personal heart rate and all of the information, so we know that you're healthy. And if there's anything worrying or anything that is not within the normal parameters, we can call you in and you don't have to wait for the next checkup during pregnancy. And here they're tapping into your sense of guilt. You want to be the perfect mom, but at the same
This is
time, you want to be
very.
healthy. I mean, you
No,
want
no,
to
no.
have
This
your
is
privacy. So this is
yeah,
the
yeah. No,
the
no. This is
mother of
scary.
all
Totally.
moral dilemmas. What do you think you would do in that case?
I will not. No, I
You would
believe
not, but
as a woman. Yeah, I
I
believe women we feel what happened in our bodies. No, no, it's so
okay.
scary.
I like your principles. You have very strong principles.
Yeah, thank you. Yes, yes. I trust so much on myself,
Okay,
I
that's
don't.
that's good. That's good. But what do you feel about this? For example, I gave you the example before about elderly people that maybe don't have a relative visiting every day. Would you recommend a relative that is maybe that has an advanced age and maybe not a very wide or a very close knit support network, and maybe their children or their
Yes,
nieces or
yes.
nephews
If
to
it's a
to have
person, yeah,
some. So for the elderly, you think it's maybe something that is more interesting, no? To
yeah,
remote monitor.
yeah, because elderly, they are actually in Spain. There's a lot of people totally isolated, over 70, 65 years old. Bueno, Cruz Roja is making a big movement now to catch volunteers just to talk by phone with all people.
Yeah,
Because
I feel very, very proud of of an initiative that the philosophy teacher in my school is doing. He's making every child in my school write letters to five uh, elderly people that they don't know, just to wish them a happy Merry Christmas. And I think
oh, that's
it's a
wonderful.
small thing that goes a very long distance. I think that kind of moral support is very nice because there's a lot of elderly people that don't have family members or they're very far away and they don't get this constant care. I think that when the priority is very clearly the patient, remote monitoring is fantastic. When
Yes.
when there can be other interests, like what you were saying, I think that's where it's a little bit touch and go. I'm not very sure if I agree. And
Yeah,
I and
but if you
and
don't have other let's say other research, and you're an all one, and there's no one around you, and you don't have even these volunteers, and you need these monitoring devices with you, at least you have something.
yeah, yeah. Um, I am a happy customer of e-prescriptions. Do you know what that is?
The one that you go to the pharmacy and directly they tell you this.
Well, no, it's not that. It's rather um you know that you're going to have medicine for a long time, and your doctor anticipates what you're going to need.
Yeah. You
They
go with the
prescribe it
insurance
directly.
card and they give
So
you
for example,
directly.
yeah, you don't have to go back to the doctor just to get
Yes.
the paper prescription that we've all grown used to, and you have that recurrent prescription, especially if you have, I mean, fortunately, I don't have to take any medicine chronically, but I know a lot of people that do have to
For
take medicine
allergies
chronically.
working like this.
Allergies, yeah, my daughter has recurrent allergy prescription. Yeah, so for me, this is one of the big breakthroughs of our times, electronic prescriptions.
This is good, yeah. But sometimes you know what I observed in Spain? Instead to give it to you each month, they ask you, what do you need? Do you need the spray or do you need the eye drops? No, what
Mhm.
I need, no, give it to me because it's once per month, no?
Yeah, and
But they
it's my
ask you, what
right.
do you
It's
need?
there. Just give it to me.
Yes, but they
Yeah,
ask you, I observed
there
they
is
ask
a
you.
there is a drive in Spain to cut on medical waste, pharmaceutical
Mhm.
waste, and I can understand it. I don't know if you agree with me there.
Yes. Yeah,
There's a
yeah,
lot
totally.
of pharmaceutical waste that we can cut down on. Mm, and yeah, but it's maybe it taps a little bit into, if you're a reluctant person, if you say, oh my God, I'm shy of asking for this prescription, you don't want to go back and say, no, I need everything, please give me everything. It feels
Maybe
a
because you are
little,
traveling, no?
yeah,
Don't you
exactly.
think about the people, the old people who go to Benidorm maybe 1 month and they need the whole thing in the luggage, you know?
Yeah, completely. I
Yeah.
agree completely. And would you um if it would you believe it's a good idea to increase, I think I'm gonna get a no from you. Um
Mhm.
to let a machine, or a combination of machine learning and artificial intelligence and some human interaction, to decide in a hospital who gets treated first and who gets treated next. Right now, it's 1%, 100% human. There's a person that does the triage, which is basically to decide who gets attended by a doctor first, and who gets attended in the next place, in the next place, in the next place.
Mhm.
Basically, to anticipate the important things over the things that can wait. Would you agree that part of this
Actually, no.
information is going through technology to decide, yeah, or to help the human being be more efficient?
No, actually, no. Actually, the workforce should be like should come from humans.
Okay,
Yes, maybe
but
it can help, but you know, there is a lot of tricky, corrupt people.
oh
So how
yeah.
they will use it?
Exactly. Well, this is exactly what I was talking about. A lot of that information is going to be in the cloud, and who's
Yeah.
going to have access to that information? I mean, if there's a
Yes.
data breach, am I sure that Sanitas is going to have good professionals taking care of the security of my information, or it's going to be hacked by the dark web and sold to, I don't know, people that have ill intent and want to steal my information for whatever use?
Yeah, totally. And will happen what you say before. You will not get the mortgage for the new villa because
Exactly.
they will
Yeah.
spy your
That's
information.
that's a case that I remember when I was talking to the chief technology officer from Telefonica. He was saying that this is one of the biggest, not dangers of the future. He says it's the biggest reality of the future, and we've already given up our privacy, and now we just have to manage this reality. There isn't a way back from giving up so much
Yeah.
privacy. When we signed
What
up
happened
for
with Facebook? With Facebook, you
when
share
we
everything.
signed up for Facebook, when we signed up for free email, we got a Gmail account or a Hotmail account or a Yahoo account. We already gave up our privacy on so many levels that we haven't thought about. And now that all of that is coming back to bite us in the butt a little bit, is when we're worried about it, but it's too late. He says your
It's too
information
late.
is already out there. I mean, maybe you
And-
can stop sharing future information, but your base information is already out there. They already have it. I mean, I have an Android phone. My Google knows exactly where I go every day, what I do. I guess it knows when I eat out or when I eat at home. What kind of ING knows what kind of food I buy, how often I go to the supermarket,
Your
what I
Netflix
spend.
TV shows.
Yeah, what I spend on my salary on, what I don't spend my salary on. If I'm making healthy choices or unhealthy choices. There's so many things that are just a matter of data mining that it's
Totally.
kind of scary in the end, right?
That's why, for example, now people in Instagram, they are sharing histories, but they are not sharing posts anymore.
Okay.
Because they don't want to be catched, and histories last only 24 hours.
Okay. You call them stories.
Stories, sorry.
So they don't post the
Stories.
information, they publish stories, right? Because of that, because of privacy.
Yeah, I think so, yeah.
Yeah, it makes sense. It makes sense. I'm old fashioned. I still go for the post and I'm making a mistake. Okay, so talking about AI vocabulary that we can talk about. I've been talking about AI assisted diagnosis. I remember that I was fortunate enough to be the teacher for a short while of the director of the Zarzuela Hospital in the Sanitas Hospital in La Florida in Madrid, and he toured me around the hospital, and he was talking to me about a certain machine that he had bought that he was very proud of. It's called a Da Vinci machine, and there's a slide here that has one of those Da Vinci machines. They're like tomography machines, and they make like very, very advanced diagnosis. And what he explained to me is that basically a private hospital or a private clinic, they have very similar resources they have less resources than a public hospital. This is La Florida is a very small hospital. La Zarzuela, sorry, is a very small hospital. It only can host 100 patients or 150 patients at the same time, and maybe La Paz has 800 patients at the same time. But in terms of how often they use their advanced machinery, at Zarzuela Hospital, they're using it 12 hours a day. And in Gregorio Marañón or in La Paz, they're using it twice a week for 5 hours because they need a professional to be working on that computer. They've just decided that for them it's crucial to be able to do many tests because that's going to be it's going to be a good service for the patients, and why not? It's also going to be profitable for the company. So it fulfills the two purposes of a private hospital. And since previously it would be a doctor that would check one by one the medical imagery, it was a very slow process. So maybe they would take pictures of potential tumors, and they would take maybe 3 months to give the results to the patients. But now they run it through a computer. The computer discards everything that seems 100% healthy, and it only gives them a very small percentage that has to be checked by the human eye. So this is AI-assisted diagnosis. What do you think about the system? Did I convince you, Maria, that it's a good system?
Yes, this one,
Okay.
yeah, I support this idea.
Okay, so it's
first
basically
one.
saying everything that seems healthy, we're immediately telling the person, a computer has checked this, you look 100% healthy. And I think that in general, people are going to trust that. It's like, okay, yeah, that's good enough for me. And people that feel that it needs a second look goes to a doctor. The doctor says, okay, I don't have to look at 300 anymore. I have to look at 30. So I'm going to be able to do this in a week instead of in 3 months. So that speeds up the diagnosis
has meaning,
process.
yeah.
That is
Yeah,
super
that has
important
meaning.
at the end of the day to to be able to give a good a good and an early diagnosis to be able to treat certain illnesses. How would you feel if suddenly your telephone, you get an alarm and it says, your blood pressure is very high, and and you have a scheduled appointment at your doctor for next week because your telephone has detected that you should probably visit your doctor. How would you feel about that?
Oof, I will be so scary, and even with this phone call, will be higher even. I, I don't know. I think
I
that
mean, you're
the human
for you
factor is
because
very
this
important.
is what we're buying into. We've bought into allowing our technology to make decisions that we would make anyway. And this automation of things, like, okay, so if I see that for 5 days in a row you sleep 3 hours, I'm sending you to your physician so you can check what's wrong. And it sends an alert to your physician saying this person is not sleeping enough. This is an automated message created by Apple Watch. Um,
Oof.
how would you feel about that? It would be good, but at the same time, it would be bad.
It will be scary because you have the feeling they are observing you 24/7, but the last word is always in the person because you can remove this smartwatch.
But don't you feel that? I mean, sometimes I open Google Maps and Google Maps tells me what I'm going to do. I'm so scared of
No,
it.
really?
It tells me, "Are you going to this?" And I said, "I've only been there twice. How do you know that?" And it's like there's a pattern of behavior, and you're following the
Oh,
same pattern of behavior, and your telephone is already saying, "I know you're going to do this, so I'm saving you 2 clicks by offering you directly to do that."
yeah,
I love
I
it and I hate
understand.
it at the same time.
Yeah, sometimes you think like the coffee shop you have been before is so famous because it's you see the name in Google
Exactly.
Maps. And
Yeah,
they
yeah,
didn't know, just mean you visit twice. Yeah.
yeah. So this
Yeah.
is all of these things. It's like a clinical decision support system and an algorithm that learns over time and gives you automated alerts, and sometimes even makes it takes steps in the background to help you. We're running very low on time, so I want to talk about. And we've talked about most of the things. I mean, I'm really happy with the conversation that we had. I hope it was useful for you to think about these ideas. I've had a very nice time these two
Yeah,
hours.
yes.
Um,
I actually I will add maybe sometimes we need like a 5 minutes break in the middle.
yeah,
I
sure.
don't know if the if
If
what
it's okay. Yeah, yeah. I don't like to take those breaks without the students asking me to, because it feels like I'm just tired of teaching, and
no no.
I've gotten used to doing 2 hours or 1 hour and a half. So I just go through it. I power through it, but a bathroom break in the middle is always a good idea,
Yes, this is
or
welcome.
something similar. Yeah, yeah. Whenever you need, if you need, I mean, for the next class, if you need us to stop in the middle, it makes more than sense. It's more than common sense to do so. Okay, so
Thank you.
this is just a recap of some of the information that we've been talking about. What telemedicine can look like, what kind of information. I'm really anxious to look for the Chinese hospital example, because I love the use of robots for things that it makes sense to use robots for, like moving heavy equipment from one place to another.
Here there are
Um,
robots in the airports.
there are robots in the airports. There are robots in restaurants. There are robots in coffee
Here, I
shops.
mean,
It makes sense
here
for
they're
robots
in the
to
airports.
exactly, yeah. It makes
Yeah.
total sense to have them in a hospital. So,
Yeah.
um, what about the telesurgery for a surgeon to be operating on a person that is maybe in Cuenca or in Africa, and they're operating from Riyadh? How do you feel about
Eh,
that?
I don't know. I just think about the mistakes. I don't know. You shut down the power on this
Oh
with the
yeah,
tools
but
inside.
the other option is this person is going to die because there isn't a doctor in the area.
If there is a threat to the life, yes, of course, but if you can just transfer to the location or move, or I don't know. I don't know. This is really very deep conversation because, for example, there are some countries who have more knowledge and develop about some, let's say, treatments,
Yeah,
and only have the opportunity the people who are living near. No, it's not fair.
exactly.
So it's
Yeah,
not fair.
it's
Yeah.
like the proximity factor.
Yeah. So yeah, we have to support also the idea of telesurgery, even though
It's
can
scary.
be,
It's scary.
yeah,
I
little
understand what you
scary.
mean. Yeah, yeah. It's like midway through, you lose power, and you're like, "Oh my God, what happened now?" Yeah,
Oof.
yeah, yeah. So, there was I've still got things in the bag, but I don't have time to flesh them out, especially not today, that because I have um the dinner party at my school, so I have to go back. I have to get ready for that. I
Yeah,
can't
yes.
go over the hour. I have to cut a little bit. I have to be a little
No, no,
bit
it
strict
is
with the
time. It's
ending
time.
hour. But I, the truth is, I'm really comfortable in this conversation. I've had a lot of fun, so I would stay a few minutes more and chat more about this. Uh, that way we can keep a little of this excitement in the bag, and when we um adjourn after Christmas, I think it's on the 12th, if I'm not mistaken with the date. Then the following Friday to Reyes here in Spain, which is like the
I
mother of
think the
all
ninth. The
Christmas.
ninth.
Yeah, whenever that is. We'll get together and we'll have our last class, and maybe we can do a recap of all the different
Perfect.
information that we've been talking about. And let me recommend you, Maria, check out the language courses because you're going to
I will.
shine, and it's going to help you because I think you need an English certificate for your grado. That one can also serve as
Yeah,
a
yeah. And
covering, checking that box of
when
having
I
the.
talk to you, I feel level 0.
No,
So
no, 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 no. You're C1 minimum. You can feel comfortable in a C1 course and a C2 course for sure.
I will
Have
check.
I look forward to talking to you and hopefully to many more in the
Yes.
following class. Okay, so thanks a lot
Okay.
for connecting
Have a
and
nice
talk
have a nice weekend.
the same to you. Have a nice Christmas and
Thank you.
enjoy these days with your family. Okay,
Thank you. Bye bye.
goodbye.